There is no country that can develop without a productive workforce.
The work started in 1988 when I was by then the Deputy Vice Chancellor of Makerere University.
And only 43 students at that time were admitted.
This was our only lecture block. This legendary room called the Main Lecture Theatre, abbreviated as the MLT.
The Bachelor of Surgery and Bachelor of Medicine was the first program to be established in this university.
Currently, the department trains both undergraduates and postgraduates.
When we talk about,
we go and do camps where we operate on women in different parts of the country.
Our main partner is the Ministry of Health. Global Fund also helps us. There is an organization called CHAI. All these help us. Then there is government-to-government program.
Over time, there's been, I'll talk particularly about internal medicine where I work. There has been an improvement in the kind of services that we offer. Right now, our students, as they're doing their postgraduate training, will be exposed to the different areas of medicine.
On average, we admit about 50 students for the direct program and about 40 for the completion program, and they go through a number of courses.
And now we are beginning to translate that knowledge into products. So now moved on from just bachelor's degree to master's programs.
We mainly teach our students in the lab to do the synthesis, the discovery, and the design of these drugs, most especially from natural products.
They go to simulation labs in preparation for bedside teaching. So within the simulation labs, they are working with mannequins or robots, and then they go to the hospitals where they are taught directly from the patients.
The staff of the hospital and the staff of the university work together to make sure that those students are actually taught.
And being a regional referral, we get to meet cases that are probably not very common out there, so it makes us outstanding doctors.
So medical simulation is a method of teaching and learning where teachers recreate real clinical situations for the purposes of learning in a safe environment.
We have come from the chalkboards to the whiteboards, markers. Teaching is ongoing using projectors. We also have a number of online platforms.
When you train students, it is very important to train them in areas similar to where they are expected to work.
We were able to serve over 300 people, and basically our focus was on NCDs.
The main aim is to inform action. We intend to gather evidence for those theories and contribute knowledge in health and medicine.
And they offered us land to set on our building where we operate from. And it's strategic because then we are close with the hospital.
Currently, I serve not only as senior lecturer but also as head of Department of ENT Surgery.
This lab, the Mass Clinical Research Lab, is in the process of obtaining international international accreditation. We have begun the process in earnest, and hope maybe before the end of this year, we should have had some of the testing that is in the lab accredited. Plan to be one-stop center for surgeries or surgical services in Western Uganda.
And come what may, succeed we must.